that our fat cells are not inert. They're biologically active. They release all sorts of hormones such as leptin, resistin.
Is it true then, that the fat cells themselves become inflammatory?
In fact, you can look at obesity as an autoimmune disease.
Well, today I have the pleasure of speaking with Mike Mutzel, otherwise known as Metabolic Mike, and I've been following him for a while now on social media. Mike earned his Bachelor of Science in Biology from Western Washington University in 2006. He also has a Master of Science in Clinical Nutrition, and he also graduated from the Institute of Functional Medicine, so practicing functional medicine. He is a published author as well, has well over 1 million followers on social media. You probably have seen Metabolic Mike. Welcome on into the show, Mike. I'm so happy that you have taken the time to speak with me today.
Yeah, my pleasure. Thanks for having me.
Well, this is so great. And I know that you're sort of like the sciencey, nerdy guy, much like I am in terms of looking at research. And, it's one thing to say, that something is good for our health or in terms of exercise, sauna, and doing all these things. It's another thing to actually see that there's some research benefits behind, a lot of the things that we talk about and promote. And, this is something that I, really appreciate that you share that sciencey, side of things for people, and you simplify it in a way that I think most people can understand. And that's why we're going to get into the science a little bit. And of course, I'm going to be asking you some practical tips as to what we can do, of course, to live healthier lives and to do our best in terms of, our diet, exercise, and things like this. So let's jump right in. I've heard you talk a little bit about fat cells and what exactly is happening with our fat cells as we're aging. Is there something that we need to know here, and is it something that, that we can have a preventative effect in terms of, beyond just we know that, yes, diet and exercise are important. Let's dive in. What about our fat cells as we're aging?
Yeah, Dr. Janine, great question here. I think it's important for people to acknowledge that our fat cells are not inert. They're biologically active. They release all sorts of hormones such as leptin, resistin, visfatin, all these multisyllabic words. And the important point is, as we get older, we naturally increase the amount of body fat we have, and we should make volitional efforts to quell that, to maintain healthy body composition and increase the relative proportion of muscle mass to fat mass that we have. Because these fat cells, as I mentioned, they start releasing these different hormones such as leptin, and leptin can perturb our appetite sensing mechanisms in the brain, causing leptin resistance, but also leptin is an immune signaling molecule. We commonly find leptin to be increased in chronic inflammatory states such as rheumatoid arthritis, multiple sclerosis, irritable bowel syndrome, IBS. So leptin is pro-inflammatory. So the more body fat we have as we get older, the more inflamed we will get. And that's problematic because actually, as we get older, we naturally increase inflammation anyway. As I'm sure you've talked about on many videos, inflammation is at the root cause of many different diseases that will prematurely cause us to suffer ill health, such as heart disease, depression, dementia, Alzheimer's, all these cancers even. So the thing to keep in mind, folks, is that we need to focus our diet, exercise, and sleep and lifestyle habits so as to maintain muscle and keep the natural age-associated gain in fat down. And so we balance hormones, we eat higher proteins, less processed carbs, we focus on resistance training, not just cardio and burning calories. These are some of the modalities that can help to decrease these changes in fat cells that occur over time. Now, it's important to also acknowledge that the fat cells that are particularly problematic are around the abdomen. So the visceral adipose tissue, the belly fat, this is particularly problematic. If you have some subcutaneous fat, this is common, as we get older, at the back of the arms, the triceps, the buttocks, the legs, and so forth. Not to say that that's always benign, but it's really problematic if one has belly fat. And so that's what we want to focus on. And the good news is when we start changing our lifestyle, we start to eat more protein, we compress our feeding window, we hit the weights instead of just slog hours and hours on the treadmill, we start to notice changes in belly fat first oftentimes. And we notice that our pants feel a little bit looser. We're going down pant sizes, and focusing on waist circumference and reducing the belly fat is going to get the best ROI from a health perspective, but also aesthetics as well, because we know that, no one feels really good in a swimsuit or, on a vacation if they have a lot of, belly fat protruding. So I think that's the thing that people should really focus on.
Amazing. And is it true then, that the fat cells themselves become inflammatory?
Yeah, well, what happens is immune cells tend to start to aggregate within fat tissue, particularly visceral adipose tissue. And in fact, you can look at obesity as an autoimmune disease. It meets four of the five defining criteria of an autoimmune disease. And so if you were to biopsy fat tissue of an individual who's maybe 7, 8, 9 years old, and then biopsy their adipose tissue after they've gained the freshman 15 in college, let's just say,
Oh,
you
yeah.
would start to see a demonstrable increase in all sorts of different immune cells, T lymphocytes, B cells, macrophages, eosinophils. All these immune cells are going to the fat tissue. And it creates this sort of inflammation that then exacerbates or worsens joint pain. For example, if you just look at osteoarthritis, people who have joint pain, when they start to lose body fat, their joint pain in their hands gets better, which is kind of curious because people say, well, I have achy knees. That's why I can't go to the gym. But once you start losing weights, the inflammation in the body goes down. So joint pain systemically tends to be ameliorated or reduced over time. So that's part of the problem is these adipocytes, as they get overfilled with energy and fat and so forth, they tend to release stress signaling molecules and they recruit more immune cells. So it's really a state of inflammation. And actually, if you want to even get deeper into that, there's some necrosis or even dying of these adipocytes and a state of hypoxia or oxygen deficiency. So there's all sorts of pathophysiologic or metabolic imbalances that occur in the fat tissue. And the bottom line is it's better to prevent weight gain than to try to lose it once you have excessive fat tissue on board. But that said, a lot of us can lose body fat relatively easily following these principles, that I'm sure we're going to get into later today.
Yes. Well, that ties in. I love that you talk about leptin because I'm all about, the leptin resistance. I discovered that for myself with my own health and my thyroid. And, in fixing my leptin resistance, you do start to see changes in, whether it's your hunger, your energy, your moods, in personally speaking, addiction to caffeine and things to up my energy because, of course, my thyroid was tanking because of my inflammation and because of that leptin resistance. So I love the fact that we opened the show talking about leptin. All my followers are right on board. They're going to be like, yes, all right, and getting some more information about the leptin, signaling pathways that is, so important. Now, when does this all start? When do we start to, lose the muscle, the sarcopenia as we're aging? Around what age? I know the research says different things. What's your experience?
Yeah, I think it really depends on activity level. Everyone's a little bit different, but you start to see sarcopenic obesity and the shift in increasing fat mass, reduction in muscle mass, even as early as people in their 30s. And so it's really imperative for people to just focus on resistance training. Most people, during their junior high or high school, even college, they might go to the gym, they might work out, but then work gets in the way. They have kids, they stop, walking and start driving everywhere, all these things. And that leads to, this inflammation and fat gain that we're talking about. So it's really important, again, just to emphasize that the muscle crosstalks with the fat tissue. And so that's the thing is the more muscle mass you have, there's different signaling molecules that occur when you exercise. They're called myokines or even exerkines. And these are hormone-like messengers that are released from our muscle tissue. They go to the brain, they go to the liver, go to the fat tissue and help with all of these different mechanisms and prevent these pathophysiologic changes in the fat tissue themselves. And so that's really, I think, the most exciting thing, that exercise is medicine. There was a consortium paper that was published in 2019 finding exercise will help reduce the incidence of 26 common diseases and conditions. We're talking about diabetes, high blood pressure, heart
Yeah.
disease, depression, dementia, cancer. The list goes on. So this
Yeah.
actually is frontline medicine. It's not just for bodybuilders, not just for fitness competitors. It's for everyday people. We should be doing resistance training, body weight pull-ups, push-ups, squats, deadlifts, hip hinges, hip thrusts. All of these things can really help you prevent fat gain, but also just feel better and have better mental clarity, energy, mood, and beyond.
Exactly. And I think a lot of people, and I'll speak to the women, a lot of women exercise to either lose weight or maintain their body weight. They're not doing it for all the reasons that you just explained, like cancer prevention, right? And I think there needs to be sort of a paradigm shift for both men and women, that exercise is so much bigger than, just maintaining, a certain amount of body fat. It is absolutely essential. Every single day you have to move your body. Am I right?
Yes,
Exactly.
100%. Yeah, really important. And speaking to women specifically, there's been many studies finding that women that are diagnosed with breast cancer have lower amounts of muscle mass compared to age-matched controls that don't have breast cancer.
Oh,
So,
that's interesting.
yeah,
Yeah.
you want to look good and feel good, but we're
Yeah.
also trying to prevent these conditions that statistically claim the most lives here in North America. Heart disease, cancer, and then Alzheimer's disease are the three. Well, COVID is in there depending upon the year. The top causes of why people end up dying prematurely or suffering from a really serious illness. So yeah, we want to look good, but we also want to be here for our grandchildren and not spend our days in assisted living facilities and things like that.
Yeah, good point, good point. Now, the question about protein comes up. How much protein do we need, A, to maintain our muscle mass, and B, to actually build some muscle mass? I know as a woman at a certain age right now for myself, where I was able to build very easily, let's say in my 30s, 40s, now I won't tell you how old I am, but at my age now, it's a little bit more difficult. And I find that I really have to be on top where, I didn't consciously think so much about my protein previously, but now I feel like I really have to be conscientious about getting so many grams. So please tell us, what are sort of the magic numbers, or what are we aiming towards in terms of, our protein intake daily?
Wonderful question. And of course, as you know, protein is very controversial. There's a big push to steer people towards less protein or even plant-based proteins that unfortunately do not contain the essential amino acids to help support muscle protein synthesis and build the muscle and help prevent fat gain like we're talking about. So the recommendations are around, from governmental guidelines, around 0.6 to 0.8 grams per kilogram of body weight. You essentially want to double that if you want to be optimally healthy. Just like with vitamin D recommendations, they're really, really low, very low to prevent overt rickets or weak bones. But to be optimally healthy, to support your immune system, you need about 10 times as much vitamin D as the authorities recommend. And so we're talking about protein, ideally between 1.2 and 1.6 grams of protein per kilogram of body weight. Now, people are converting their body weight into kilograms and all that sort of thing.
Yeah.
Just think about roughly a gram of protein for every pound of lean body mass you have. So for me, my total body weight is about 190 pounds, lean body mass about 120, 140, in that range. So that's what I strive for. But what's interesting here is as people are a little bit more overweight, they might actually need more protein to help with the weight loss and to help preserve muscle mass when they're dieting. What a lot of people do when they diet is they will have celery sticks, rice cakes, low calorie salads, and they will actually undereat protein. And that, restricting calories is one way, obviously, to lose body fat and total body weight. But the downside is there's a lot of weight regain after the dieting is completed. Maybe someone has a wedding coming up, or they're going on going to the Caribbean or Florida for a vacation. So they might cut calories for 6 weeks aggressively. But what happens is oftentimes, and research shows this, people will regain most of the weight they've lost plus some, but the downside is their resting metabolic rate is at a lower level than before they started. And so they're really coming from behind, battling from behind. It's an uphill battle. So the way that we can sort of circumnavigate that is to increase our protein while we're dieting or trying to lose body weight. And numerous recently published studies have found that obese and morbidly obese people tend to actually need more protein because of this complex phenomenon that we talked about and this sarcopenic obesity, meaning that as you gain weight, you start to strip away muscle because of the inflammatory nature of increased fat accumulation. So we actually need more amounts of protein. So there's not really there is an upper bound. We don't need to have 5 grams of protein per kilogram, but at most, people could probably safely, especially if they have a lot of weight to lose, aim for 2 grams of protein per kilogram of lean body mass on the upper end of it. Most people are going to be just fine around 1.2 to 1.6 grams of protein per kilogram of ideal body weight.
Wow. So everybody, you got to do some math there after the program. You do some math.
And there's
you
many
figure it out for
books on this.
yourself.
Gabrielle Lyon has written a book. There's tons of resources online for people. But yeah, just think about it. Roughly a gram of protein for every pound of body mass, ideal body weight. So you can get a DEXA scan. You can do the in-body look at how much lean mass you have, and you want to aim for at least 1 gram per pound of lean body mass per day. And for some people, that's going to be a lot more than they're used to eating, which might change what they eat, And I found, and I'm sure you found this clinically, a lot of people undereat calories in general, and specifically protein. It's very easy to find carbs at every, Tim Hortons coffee shop. You can get carbs, sugar and fat everywhere. It's harder to find protein. So you need to be a little bit more proactive, but we need to, plan so that we can be successful and not, fail at this.
And what are some of your hacks? What are your favorite proteins? Your go-tos in your personal diet right now? What are some of your favorite healthy and hopefully well digested and absorbed proteins? And I know it's going to be different for everyone, but what are some of your favorites right now, Mike?
Yeah. So in our household, we have a lot of eggs. We have about a dozen chickens in the backyard. So right now we're getting a ton of eggs. So whole eggs, the yolk, not just the egg white, unpasteurized or full fat yogurt, is going to be high in protein as well. Red meat, I know it's controversial because saturated fat and all that, which we can debunk if you'd like, but red meat, lamb, and really protein from ruminants. And so if we think about what is a ruminant, this is an animal that has multiple gastric chambers to help break down plant matter and ferment that into muscle mass and protein for the animal. So ruminants, I think, are going to be much healthier than monogastric animals like chickens and pig. I know chicken consumption is up significantly if you look over the past 20 years. Most people are eating a ton of chicken. As I mentioned, I have backyard chickens. We've processed them for food and things like that, but we use them for the eggs because most chickens are going to be fed the grain, canola, soy, things like that. And so the fatty acid profile is just not really going to be there. It's not as satiating, I found. So focusing more on red meat, on eggs, on yogurt, grass-fed whey protein. And you can supplement with raw dairy. I'm not a huge fan of nut milks, but if people are dairy sensitive or can't access raw dairy, that's an alternative. But you have to look at the label. I was looking at hemp milk and almond milk, and they put canola oil in there and things like that.
It's scary. It's scary. Yeah. Because they're sort of definitely marketed as health foods, and they're not so healthy. Sometimes it's better just to go with the dairy. Like even if it's not grass-fed, you know what I mean? Versus some of these plant milks, which is something that I've shared, in my content. Okay, that's great. So the healthier, you've got your own chickens, love it, love it, love it. Amazing. I'm a big egg person as well. I don't think you can ever eat too many. Well, of course you could eat too many eggs, but we eat a lot of eggs in our home as well. I just find they're satiating and they're fast and easy, and it's a great, snack. It's a great meal. It's great everything. Eggs are great. Okay, let's jump over now to talk a little bit about fasting. I think your views have changed a little bit, from what I've seen on your social media platforms. Prolonged fasting, autophagy, some, people throw these terms around. Let's get into it. What are your thoughts now on prolonged fasting?
Yeah, I think fasting has a lot of health benefits, for sure. And the research is pretty clear. When you fast for more than 18, 24, 36 hours, you see significant reductions in blood glucose, blood pressure. People who even alternate day fast, the earlier studies in the early 2000s found that people who eat every other day, who are overweight and obese have reductions in asthma and allergies and autoimmune symptoms and things like that. So I think the extended, here's my thoughts. I'll just simplify this. The more overweight someone is, the more aggressively they can go after and tackle fasting. I think that's where we really need to sort of bifurcate the recommendations based upon people's body composition and how much weight they have to lose. If one is relatively lean and already healthy and exercising, I don't place as much emphasis on fasting because they're already getting that from exercise. It turns out that when we fast, we mimic some of the same metabolic effects that we get when we exercise. Reductions in glucose, increase in glucagon, and reductions in insulin. We see these same metabolic and hormonal effects with exercise. And in fact, one study found, and this study actually really changed my mind on fasting. We talk a lot about autophagy, which is an intracellular cleanup process, and impaired autophagy is linked with dementia, Alzheimer's, brain fog, Parkinson's, possibly cancer, and cardiovascular disease. So, of course, it's alluring and seductive to think, well, fasting is going to increase autophagy, so therefore we should always be fasting and so forth. It turns out that exercise more powerfully increases autophagy than does fasting. One study actually randomized subjects. They had overweight subjects and lean subjects. The lean people exercised, the overweight people didn't, and they fasted these individuals for 36 hours. And what was interesting, at the end of the 36-hour study, they looked at markers of intracellular increases in autophagy initiation proteins. And what they found is in the lean subjects who exercised, there was a significant increase in autophagy after 36 hours, but that wasn't seen in the overweight subjects. So I place a greater emphasis on exercise, and it will make any fasting that you do a little bit more efficient in terms of increasing autophagy. So that's not to say that fasting doesn't have health benefits, but if you're into fasting, you're going to increase the efficiency and economy of your fasting if you also exercise as well. And so I like to plug exercise there as a modality in terms of increasing autophagy. And various studies have actually found this autophagy mechanism that's, again, so exciting from a longevity perspective. People who regularly exercise have significantly higher levels of autophagy initiation proteins in the liver, in the skeletal muscle, and various parts of the body compared to people who do not. So again, I think fasting is a wonderful modality. Compressing your feeding window has been shown to initiate all sorts of longevity proteins and decrease inflammation and all these things. We have numerous randomized controlled trials over the past 5 years that have shown that. But again, I think it should be contingent upon, I should say, the aggressiveness that one embarks fasting should depend upon the amount of body fat they have to lose. The more body fat they have, the more aggressive they can dial in that fasting knob.
Yes. And what I share with my, viewers and followers, something that I experienced for myself and in terms of circadian biology, is to not skip your breakfast. Like, so many people are doing the intermittent fasting wrong, in my opinion, because they're skipping the breakfast, and the breakfast window, ideally you're eating out by the sunrise, and, you're hearing the birds singing, and you're getting, all of the benefits of the full spectrum light on your skin and in your eyes, and even for your digestive tract to turn on those circadian clocks, right, in the brain and in the gut, that you miss all of that, and you can screw up your leptin signaling and increase the stress response and increase your cortisol levels in a bad way if you're skipping the breakfast. So that's something that I think, a lot of people, even if they just switch, and compress their eating window in the morning, midday perhaps, and then skipping their dinner, they may find a lot more benefit and, lower cortisol levels, if anything else, and your leptin signaling, right, if they're doing that. So
totally. I think, skipping dinner is going to be way better than skipping breakfast. And there's nothing necessarily magical about breakfast, but as you mentioned, from a circadian rhythm perspective, our gastrointestinal tract is much more receptive to receiving and processing the foods we eat in the morning and during the middle part of the day compared to the later part of the day. And a lot of people in fasting kind of became popularized, would fast all day and have this big bolus amount of food right before bed, which is perturbing sleep and leading to indigestion and possibly negating some of the health benefits. So I think it's much better to eat earlier and start your fast earlier as opposed to fast all day and have this big dinner before you go to bed.
Yeah, amazing. Okay, a question that I get from women all the time, because I love to lift weights. A lot of women are scared to lift weights because they think that they're going to get too big, too bulky. What are your thoughts on this?
Yeah, I have yet to see a client that I've worked with, or I have a lot of fitness friends in the fitness industry who are drug free, who train really, really heavy on hip thrusts, deadlifts, compound lifting. They are far from bulky. This is a perception that has been promulgated through the fitness industry and media for a very long time. It's not physiologically possible. There might be outliers, 1% or 2% of the female population that is just
Mhm.
naturally gifted to put on a ton of muscle. They are statistical anomalies.
Right.
So women should not be scared about going heavy. Now, there is this transitory period where if someone does have a little bit of extra body fat and they start lifting heavy, they might feel a little bit bigger because they still need to lose the weight over time. So I can see how
Mhm.
there is this, and I've had worked with clients who are like, well, I feel like I know I'm getting stronger, but I feel
Yeah.
just bigger.
Yeah.
That will, over time, the more muscle mass you have, the less fat mass, more and more fat will be shed from your body. So I think give yourself a little bit of grace. You might feel a little bit bulky in the interim, the 4 to 6 weeks after initiating a weightlifting program, but your body composition will change over time. So that's, I think, the important thing there. But the other thing is if someone does have the genetics to be quote unquote bulky, let's just say
Yeah.
they have really good genetics to put on muscle mass, I would say embrace it. I mean, nothing is wrong with that. And the
Yeah.
perception amongst what is considered attractive, especially coming from a male's perspective, when you see someone who is fit, who has toned arms or shoulders, this is very, I think, physically attractive. A lot of men agree with this.
Oh yeah.
So I would not shy away from that. When you go to these low carb conferences, metabolic health conferences. A lot of the women there, Tara Garrison, for example, Gabrielle Lyon, are some of the fittest people in the room. They always have a crowd of women talking to them saying, hey, what are you doing?
Yeah.
And the response is always the same. I lift heavy weights, I eat protein. So,
Yeah.
I think it's just going to take a lot of unlearning for people to realize that they're not going to turn into a mass monster.
Right.
Most of the women that you see in the fitness space that are really huge, they are on anabolic steroids paired with
Exactly.
growth hormone and peptides. So as
Yeah.
long as you're not dabbling in that world, you have
Mm.
nothing to worry about in terms of becoming overly bulky.
Perfect. And okay, so more specifically, can you give us, like, for the guys, but for the girls as well, specific exercises that are your favorites in terms of, helping to maybe tone up, burn some of that extra fat, and really from a strength perspective, we're talking longevity as well today, right? What are some important muscle groups that we're working for people that are, have never exercised before? Where would they start?
Great question. Well, I think it's really important that we focus on compound movements. So, a lot of people go to the gym and they do isolation accessory exercises that just work one joint. For those people watching, I'm moving my bicep, doing a bicep curl. It's just my elbow. That's the only joint that's moving. So, when we're doing exercises, we want to do these compound movements, and a compound movement is defined as moving two or more joints at the same time. So, what are those exercises? Well, we have pull ups. We have push-ups, we have presses, we have lunges, we have hip thrusts, deadlifts, squats. These are the compound multi-joint movements. So again, I see a lot of people go to the gym, they do some bicep curls, they do some tricep extensions, leg extensions.
Yeah.
Those are accessories that you do after you max out on the compound movement. So I encourage my clients to exercise or do resistance training at least 4 days per week and focus on one or two priority core movements during that exercise session. So for an upper body, let's say,
Yeah.
and breaking down the body into the planes, the front, the back, the upper, and the lower. If we're going to do the frontal plane, say chest, shoulders, triceps, we're going to be doing chest presses, push-ups, military presses, for example, not some isolation machine, pec deck thing,
Gotcha.
that
Yeah.
doesn't really do
Yeah.
a whole lot.
Yeah.
Pull-ups, rows are really great for the upper back.
Okay.
There's a lot
Like
of different
dumbbell
back.
rows, like with single-handed dumbbell rows. Yeah. Okay. Yep.
Yeah, single-handed or barbell rows,
Okay.
or you can
Yeah.
just get on a Smith machine and then put a bench near it and then do rows on the Smith
Yeah.
machine.
Gotcha. Yeah.
Um, those are key. And particularly lower body exercises for both men and women. Studies out of Europe, Copenhagen, have found that insulin resistance starts in the leg musculature. So
Ah,
really building up the strength and the muscular health in the legs is important, particularly the glutes. The glutes should be the biggest muscle on our body. For most people, it's not. It's atrophied, and that leads to back pain, poor posture, hip issues, and all that.
yep.
So hip thrusts are really important, both barbell hip thrusts, and there's different machines now. Deadlifts, squats. I created a course with a fitness professional, Erica Grisanti. We go through all that
Oh,
sort of thing. So
amazing.
it's
Yeah.
really important to focus on these compound movements. And once
Mm.
you've done 4 to 6 sets of each of these compound movements, then you can move down to these accessory exercise to sort of get that burn, if you will.
Oh, I see. Okay. So I'm doing it wrong.
I don't know
I
what you're doing, but
yeah,
yeah,
I do those single, like when I do my own workout day with on the machines, yeah, I'm doing it wrong. Okay, so I'm going to change. And I'll let you know how it
yeah,
goes.
focus on
Yeah.
the compound movements,
Compound
Dr. Janine.
first and then
Yeah,
go the other way. All right. That's see, I'm learning for myself. Amazing, amazing.
there you go. Nice.
Um okay, I know that you've talked about centenarians. And
Yeah.
for people who don't know what that is, somebody who's, living healthfully into their year 100 and more, perhaps. What does the research show? Are there some commonalities in terms of what these people are doing, the centenarians?
Yeah, this is very curious. And of course, we have Netflix documentaries and so forth talking about this as well. But this interesting study came out in the fall, finding characteristics in blood work in people at the age of 60 versus, and they track these subjects for some 28, 30 years, finding if there's any sort of changes in blood work or associations at one's 60th birthday and how that is associated with the odds of them reaching their 100th birthday. And it turns out that having high total cholesterol
Uh-huh.
was associated more strongly with one reaching their 100th birthday compared to having low cholesterol. So I think that's important because we hear so much about how cholesterol is so damaging.
Of
It's going
course.
to
Yep.
cause your arteries to clog. But it turns out that having high cholesterol, particularly over the age of 60, is protective. So that's one thing I think that is
That's
quite
amazing.
fascinating.
And
Yeah.
should we unpack that a little bit for people who don't know about cholesterol and why cholesterol is so important? Let's just go there a little bit because a lot of people, I think if we explain it, then it makes more sense for people to understand and sort of say maybe to their practitioner, their doctor, whoever ran the blood work to say, it's not the worst thing, doc. Maybe I don't need to go on a statin. Because let's unpack it just a little bit. I think it's an important
Sure.
topic. Yeah.
Yeah, very important, very controversial topic. The mainstream medical community has been monomaniacally focused on lowering cholesterol for the past 50, 60 years. And we're not seeing heart disease rates go down. They're actually going up. And so
Yeah.
this focus on low fat diets and low cholesterol and so forth doesn't really corroborate in terms of the outcomes that we're seeing. And so it turns out that cholesterol is an essential fat part that every single cell membrane, we need cholesterol. All of your cells, without cholesterol, we would not be alive. So it's absolutely necessary in terms of survival. But it turns out that it is associated and can be found in arterial plaque. And that's why it's so confusing because we see this cholesterol in food. Dietary cholesterol is completely irrelevant to serum cholesterol. There's no correlation between a diet high in cholesterol and high blood cholesterol. In fact, if one is worried about their cholesterol, one of the foods that actually increases serum cholesterol, and I'm not saying avoid it, is coffee, right? So no one is
Yeah.
like avoiding coffee to lower their cholesterol. So there's
No.
very minimal association with dietary cholesterol and blood cholesterol. So that's myth number one. Myth number two is just because your blood cholesterol is high, it doesn't mean that it's going to be deposited in your coronary arteries, which is really where your carotid arteries, coronary arteries don't want a lot of arterial plaque. It's very complex, and it turns out that plaque, well, now a new study from the New England Journal of Medicine found that our carotid artery plaque is actually, there's a high correlation with plastics being deposited, microplastics from plastic water bottles and
Yeah.
disposable coffee
I
cups.
saw, that you posted about that. Yeah. Interesting. People need to wake
So
up about the plastics. Yeah.
it's wild. There's so much about the deposition of plaque and the occlusion or narrowing of arteries that we just honestly don't understand at this
No,
point. And so
right.
we've been beating the cholesterol drum on a mainstream medicine level for the past 60 years. Heart disease has still been the number one cause of mortality. If you look at people who die of a heart attack, about half of them have low or low normal LDL cholesterol, the so-called bad cholesterol. So this relevance is not really there. I think it's important for people to understand the signature of all of their different metabolic related parameters, including blood pressure. Triglycerides are an independent risk factor for heart disease and maybe a little bit more predictive than LDL cholesterol. And
Mm.
that I think should get a lot more attention than total cholesterol. And we know that triglycerides increase in people who are insulin resistant, who have prediabetes and belly fat in these things. And so we really need to look at LDL cholesterol and total cholesterol in the context of other related metabolic health parameters, not just monomaniacally focusing on lowering LDL cholesterol at the expense of other biomarkers. So I think that's the important takeaway. And I think thirdly, it's important to understand that the cholesterol, specifically LDL cholesterol, is necessary to cause plaque, but it's not sufficient. And Peter Attia has talked a lot about this in his book Outlive, and we have a lot of other doctors that are now talking more about this. It needs to be modified in order for the plaque and the inflammation to narrow the arteries and cause the occlusion or the plaque and so forth. So we really want to support our entire metabolism and focus more on metabolic health, decreasing glucose, eating less processed foods. That's basically the take-home message here is numerous studies find that the big harbinger in terms of heart disease is ultra-processed food consumption. That's when we started to see the introduction of low-fat foods, margarine, Crisco, lard, canola oil. That's when we started to see the rates of obesity and heart disease start to skyrocket. And so if we're not eating these processed foods and eating more whole real foods, our LDL cholesterol might go up. And this does happen in a subset of people known as lean mass hyperresponders. They do have high LDL cholesterol, but it turns out their triglycerides are low and their HDL, the so-called good cholesterol, is increased as well. So we need to look at this in a constellation, not just focusing on one biomarker.
Right. And that's what Big Pharma likes to look at those, right? Because if there's a reason that there's a prescription written and made, then everybody's happy. But I mean, as the end consumer, that's not necessarily what we want. And that's why, I love the way that you explain that in terms of looking at the full package. It's the full package deal when we're talking about cholesterol. And are you exercising? And are you, eating all those refined carbs and, refined foods and packaged foods? Are you getting outside? I mean, there's a lot of data now, I think, that's looking at, and a lot more studies to come in terms of sunlight exposure and how that's increasing the nitric oxide and decreasing cholesterol. And the way that I look at it very simply, if your cholesterol is high in a bad way, if it's not well balanced, do you have the sunlight, that's using that cholesterol to make conversions to vitamin D? I mean, that's a simple, very simplistic way of looking at it. But I think a lot of us are guilty of being indoors under artificial light. We're not getting outdoors. And that's a huge component of, the entire cholesterol story as well, which I know because I actually went and studied some of the centenarians in a few years ago, and we were in contact with the head researcher who actually, when you see the movies about the blue zones and things, well, the head researcher was someone that we got in contact with, and he helped us, and he took us to, a few homes of these centenarians, and I was able to sit down and actually interview them in Costa Rica. It was amazing. What an life-changing experience. And the one thing that they do have in common, because everybody asks them about the diet and their movement and their exercise, the one thing that stood out to me was, of course, their social life and their social connections was huge. And that is a commonality across all the blue zones and for centenarians. But the other thing that nobody talked about was, of course, having sunlight exposure. They basically live outside. So they're not and I think of Trinidad, and we'll show some pictures of her here in this video. Love this woman. She was beautiful. She was 103 when I met her, and she basically lived outside. And that, we can't discredit the fact that the sun and our circadian biology and being outside in that natural sunlight is, super, super important, and helps our metabolism, helps our ability to break down our food. Of course, in this village that we went to, they were, did not have a lot of financial means. They were, poor, but to their credit, because that's part of the secret sauce, I think, was that they didn't have the, packaged foods, and everything was, farm to fork type of lifestyle, which I believe is a commonality across the blue zones as well, which is amazing.
Wow, that's awesome.
Yeah, so that was quite an experience. Okay, another question, really quickly. Sauna. Okay,
yeah.
I know that, let's not get into the data and all of that. How do you use the sauna? When? How long? Before exercise? After exercise? Infrared? Traditional? Give us your sauna technique.
Yeah, the research on sauna is quite compelling. I got really into this in 2013. I built my own sauna using a Finnish-inspired wood-fired stove. And so I actually did a sauna this morning. And so when it comes to sauna, the mechanism is heat.
Yes.
When you get hot, you sweat, and the heat shock proteins, these intracellular signaling molecules will, clean up. They work similarly to fasting in terms of autophagy and cleaning up broken proteins in our body. So, and I think the other important point of sauna is it helps redistribute blood throughout the body. It's really good for heart health. The research shows that lower prevalence of heart disease, fatal heart attacks, as well as getting dementia and Alzheimer's. So the research is quite compelling, but I think people should just access sauna that they can afford and their space allows. If you have a flat in Manhattan or New York or downtown Toronto, just get a sauna blanket. That's probably going to be the only thing you have access to, unless you have a community sauna center. And so doing that, and I think there's some personalization here. I did it this morning, for example. I got up at 5 a.m, did a sauna. It really helps, my brain function, memory, motivation throughout the day. I do listen to a podcast, put some water on the rocks, get really hot, sweat, take a shower, right? But if I, didn't have access to that, I probably would just go in the sauna blanket and then shower afterwards. And so we want to do this for 10 to 15 minutes. It's just like exercise. We want to feel our muscles burn from exercise. With sauna, we want to get hot and get sweaty. That's really where the magic comes in. Yeah. There's no real superiority of an infrared sauna versus a classic Finnish sauna. Again, the mechanism is heat. The benefit of an infrared sauna is they're small. You can put these in a condo or apartment. There's single person or 2-person saunas. That's where I started, with that. That was great, but upgraded to the wood-fired sauna stove. That gets up to 220, sometimes 230 degrees Fahrenheit, which is really, really hot. That's the infrared sauna taps out at about 160 degrees. So you have 60 more degrees to sweat and detox and all of that. So I think people should try this before bed, try it after exercise, do it in the morning, see what works for you and your schedule. Some people have really stressful jobs, very busy days. The sauna is a natural way to unwind and de-stress from that day. Other people, have cush days, and they might find it just a routine of going to the gym, and then after the gym, go in the sauna. So I think that's some of the benefits there, but we just need to personalize and just access whatever sauna we can with the budget that enables us to do so.
Yeah. And no matter what climate you're in. So for people that live, more tropical, there's still a benefit. Now, certainly if you're in the tropics, and we're jealous, and you sweat a lot during the day, and you actually spend time outside, then you may not need the sauna as much. But let's flip the coin here. Cold exposure as well. So are you doing the dunks?
Yeah. So I have the Morozco Forge cold tank. That's phenomenal. So what I like to do is get hot first and then go in the cold. The only sort of caveat when it comes to cold, you can get benefits from going in a cold shower. I know the groundwater in the Toronto area, all throughout Canada, is really, really cold. So start out with a cold shower. That's an easy way to get into this. Do a polar plunge with your friends on the weekends. Those are great ways. But the only thing about cold that people need to really be considerate about is you don't necessarily want to do that right after exercise, particularly resistance training exercise. So give yourself a couple hours. You can get hot after exercise, but if you get cold after exercise, Remember, exercise is acutely inflammatory. It's not bad.
Mm-hmm.
Acute inflammation is okay. Chronic inflammation is not good. So now cold decreases inflammation. So we sort of negate some of the benefits of exercise if we get cold immediately after exercise. So that's the only caveat when it comes to cold.
And that's what the research showed, right? That in terms of muscle strength and size, it was compromised. Yeah, it was compromised by doing cold right after exercise. Whereas the heat has been shown, I think, in the research, right, to help to increase or maintain muscle mass after exercise.
Yes.
Okay, good.
Exactly.
Awesome. Well, that was such an amazing conversation, Metabolic Mike. I encourage everybody to check him out on social media. And what an enlightening and, I love, like I said at the beginning, the science and the nerdiness behind, some of and putting some of the science behind what we often will hear is, there's a lot of information out there and misinformation as well. And that's what I appreciate about all the work that you do, Mike, is that, you're putting, some validity as found in the research into practical things that we can do every day to stay healthy or get healthier, burn some more of that body fat, and of course, do that functional training as well to make sure that's the change that I'm going to make now. Just going to swap it up a little bit and do those bigger movements first, and then do the more isolated exercises afterwards. I thank you so much for spending time with me today, Mike. It was great to have you.
My pleasure.
On. Thank you so much.
Thank you all. Appreciate you.
All right. We'll see you.
Thank you.